SARA stands for Standing and Raising Aid, and the SARA 3000 Standing and Raising Aid enables a single caregiver to provide first-class care during everyday patient handling activities. In particular, the SARA 3000 can eliminate the manual pivot transfer, transfers for toileting, and other transfers from wheelchair, bed, or recliner. The SARA 3000 is ideal for those patients who are in need of moderate assistance, typically requiring two-person assist. The patient can bear weight on at least one leg, is conscious, and able to understand instructions, and can undergo moderate pressure in the lower to mid-back. Improved support for the patient's back is given by the wide sling, which is made of a special non-slip material. This unique sling prevents the sling from riding up the patient's back in an uncomfortable position, maintaining safety and security. The waist belt is easy to attach and fasten with strong double clips. The substantial belt and double clips not only ensure the required level of support, but also look and feel very safe, which considerably enhances a patient's feeling of security. There are a number of sling sizes identified by the trim color on the sling. Yellow is medium, green is large, blue is extra large. The size of the patient's sling should be determined in advance and noted on the patient's assessment. The patient should be seated on the side of the bed or lean forward in the chair. Before approaching the patient, the caregiver should always tell the patient what they are going to do and have the correct size sling ready. Although a patient can be put into the sling with the SARA 3000 close by, it may be easier to do so with the SARA 3000 moved away. The caregiver should stand in front of the patient and maintain contact with him or her while the lifter is in reach of the caregiver. Encourage the patient to lean forward slightly to enable the sling to be placed around his or her lower back. Position the sling around the patient's back so that the bottom of the sling lies horizontally about 2 inches above the patient's waistline, with the patient's arms outside the sling. Ensure that the support strap is separated and brought loosely around the body and is not twisted or trapped behind the patient's back. The support strap must always be applied when using the sling. To fasten the support strap securely, press the buckles together. The strap should be tight but comfortable for the patient. The support arm should also be in the starting or lowest position. Adjust the height to avoid approaching the patient at eye level. Make allowances for the patient's arms and any obstructions such as chair arms. It is easy to maneuver the unit into an optimum position so that the caregiver can then help place the patient's feet on the footplate. An adjustable chassis makes otherwise troublesome transfer routines much easier. This powered feature, controlled by the handset, allows the chassis to be widened to go around bed casters, wheelchairs, or armchairs, providing optimum positioning for the transfer. Approach the patient from the front with the lift. Stop before the foot support and knee support come in contact with the patient. When the patient is ready, help or allow the patient to place the patient's feet on the foot support. Carefully push the lift in closer to make full lower leg contact with the knee support. An assessment must be made as to whether the patient requires the lower leg straps because of instability. Apply these if necessary. The wheel lock should also be applied for lifting. Attaching the sling is an easy operation. Simply apply the clips to the attachment points and secure them for safety. The patient should be supported by the sling, but not pulled forward too much. Stand to the side of the patient, placing your hand on their shoulder for reassurance. If possible, the patient should then hold on to the patient's support grips with one or both hands. The patient is then ready to be lifted. Encourage the patient to use existing leg strength and muscles to activate and assist themselves into a standing position. The handset allows easy control of the lifting and raising action while allowing the caregiver to stay close to the patient. Use the lift button on the control handset to raise the patient to a suitable and comfortable height for the particular function. Remember that if the control handset button is released during the lifting or lowering procedure, powered motion will stop immediately. For their safety, The patient's feet should always remain in full contact with the foot support. When lifting, check to ensure that the patient's feet do not lift from the support or floor. If this should happen, lower the patient immediately until his or her feet fully reach the support or floor. Always check that the sling adjustment clips are locked into position and in tension as the patient's weight is gradually taken up. If patients can stand well and lock their knees in the normal way when fully raised, their knees will come away from the Proactive pad and they will be able to perform a standing exercise while having the safety and comfort of the sling. Patients who can only hold on with one hand, such as those who have suffered a stroke, may still be lifted with the Sarah 3000, but their disabled arm may be secured against the patient's body during the lift. Physical therapy should be consulted and this level of patient assessed before being lifted. Once the patient is in a standing position, the lift may be unlocked and moved to the destination chair, commode seat, or toilet. The Sarah 3000 can be moved from the caregiver front or from the side, whichever is more convenient. Watch for pinch points to the patient and caregiver as you maneuver the lift into tight areas and through doorways. Because we do not want to pinch the patient's legs when lowering, we remember that we lock to load, unlock to unload. Push the lift close enough to the chair or toilet so that the back of the patient's legs are touching against the edge of the bed, the toilet, or the chair. Prepare the patient for toileting if needed, and lower him or her to the chair, bed, or toilet. If the patient is going to a chair or bed, the sling can be removed until the next transfer. If they are being toileted, leave the sling in place until the patient returns to the chair or bed. Apply the chassis brakes if leaving the patient at the toilet. To take a weight with the scale on the Sarah 3000, simply push the scale button. A net weight without the sling can be calculated by pressing the scale button before or after the transfer with the sling on the lifter bar. Let's talk about some other details of the Sarah 3000. It has 2 rechargeable batteries and a charging station. The battery discharge indicator, located on the cover above the battery, shows how much power is left in the battery. It is best to change the batteries every 12 hours for maximum battery life. If the indicator shows amber, the battery should also be removed and charged. The caregiver should not use the lift when the light indicator is red. To remove the battery, push the button at the top of the battery pack, then pull it out carefully. The second charged battery can be inserted into the Sarah 3000 by placing the bottom in first and then pressing the top end in until secure. To charge the battery, take it to the charging station, carrying it firmly by its handle and plug into the charger. If the battery is very low, it will take approximately 8 hours to charge. The service meter displays how much the unit has been utilized for important preventative maintenance scheduled procedures. In case of an emergency or loss of power, the Sarah 3000 is equipped with a red emergency release knob located on the side of the chassis. The Sarah 3000 can be cleaned by wiping down with disinfectant. All surfaces should be wiped down between patients. When heavily soiled, the sling should be laundered in accordance with the manufacturer's guidelines. The Sarah 3000 makes everyday patient handling routines and transfers safer and more comfortable for caregiver and patient and promotes rehabilitation. Using Sarah 3000 helps to improve both the standard of care and the working environment.